Hello everyone, and welcome back to another episode of BrightLearn, where we dive deep into the stories that shape our world. Today, we're taking a journey into the heart of modern medicine, a world filled with both incredible advancements and shocking realities. We're going to explore the lives of two very different doctors, the culture of secrecy in hospitals, and the urgent need for transparency in healthcare. So grab your stethoscopes and let's get started. Picture this. It's your first day at Harvard, one of the most prestigious medical institutions in the world. You're filled with excitement, dressed in a crisp white coat, and trying to look the part of a confident doctor. But there's one problem. Those pesky packaging folds in your coat keep giving you away as a rookie. This was the reality for our first protagonist, a young medical student who found himself in the midst of a healthcare system that was both awe-inspiring and deeply flawed. Meet Dr. Hodad, a surgeon whose nickname, Hands of Death and Destruction, tells you everything you need to know. Despite his charming bedside manner and the adoration of his patients, Hodad was notorious for his poor surgical skills and dangerous judgment. Patients would leave his care grateful, unaware of the shoddy treatment they had received. How could such a doctor continue to practice? The answer lies in a system lacking standardization and oversight, where patient satisfaction often masks the truth. Contrast this with the Raptor, a surgeon who, despite his abrasive personality and terrifying demeanor, was a master technician in the operating room. His surgical precision was unmatched, but his bedside manner left much to be desired. Patients feared him, yet his colleagues respected his skill. Raptor and Hodad represent two extremes in the medical profession, highlighting the dilemma faced by patients and healthcare workers alike. How do you find a doctor who is both technically proficient and compassionate? As our young medical student navigated this complex world, he discovered a troubling pattern. Many doctors, like Hodad, were allowed to practice despite their incompetence, while others, like the Raptor, were feared but respected for their expertise. This led him to a startling realization. The only way to truly judge the quality of healthcare is to ask those who work closely with doctors every day, hospital employees. This insight led to the development of the Hopkins Safety Culture Study, a groundbreaking survey that measured the insider's perspective on hospital safety and teamwork. The results were eye-opening. Hospitals with strong teamwork and a positive safety culture had better patient outcomes and lower infection rates. Conversely, those with poor teamwork and a negative safety culture struggled with higher complication rates and dissatisfied staff. But the journey doesn't end there. Our young doctor also encountered the harsh reality of impaired physicians. Dr. Lucian Leap's question, "How many of you work with a doctor who is unsafe to be practicing?" revealed a shocking truth. Many doctors are aware of their colleagues' incompetence, but feel powerless to act. State medical boards, often more interested in protecting doctors than patients, fail to adequately address the issue. The story of Dr. Michael DeBakey, a world-renowned surgeon who operated on the Shah of Iran, illustrates the dangers of blind trust in a celebrity doctor. Despite his reputation, DeBakey made a critical error during the surgery, leading to the Shah's eventual death. This case underscores the importance of experience and the need for patients to seek out doctors who specialize in their specific condition. The tale of Gretchen and Ronald further emphasizes the perils of choosing the wrong hospital or doctor. Gretchen, misled by clever marketing, ended up at a facility that couldn't provide the care she needed. Ronald, on the other hand, fell victim to a surgeon who favored outdated, invasive procedures over modern, minimally invasive techniques. Their stories highlight the importance of being an informed healthcare consumer. The tragic death of Michael Hurwitz at Mount Sinai Hospital reveals the dangers of poor teamwork and inadequate staffing. The hospital's decision to cut nurse ratios and rely on an overworked intern led to a preventable tragedy. This case serves as a cautionary tale for hospitals and underscores the need for better management and communication. Children's hospitals, often seen as charitable pillars of the healthcare system, are not immune to the problems of excessive executive pay and lack of transparency. The exorbitant salaries of some CEOs, coupled with the hospital's reluctance to disclose how donations are used, raise serious questions about accountability. The rise of robotic surgery, despite a lack of clear clinical benefits, highlights the dangers of unchecked technological adoption. The high cost of these machines, coupled with the potential for misuse, underscores the need for rigorous evaluation and transparency in healthcare technology. Finally, the concept of open notes and the use of cameras in healthcare settings offer promising avenues for increased transparency. Allowing patients to review their medical records and providing video recordings of procedures can empower patients, improve communication, and enhance accountability. In conclusion, the journey towards a more transparent and accountable healthcare system is just beginning. But with the growing demand for change from both within and outside the medical profession, there is hope for a future where patients are truly informed and empowered. Thank you for joining us on this episode of BrightLearn. Until next time, stay curious and stay informed.
This has been a BrightLearn video from brightlearn.ai on the book, Unaccountable, What Hospitals Won't Tell You, and How Transparency Can Revolutionize Healthcare by Dr. Marty Makary. Visit brightion.com for more fascinating videos like this one, and visit naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.